Let's start. So we're excited to have you today. Honestly, we planned this interview early, and you're the first one we interviewed this year. So it's really a nice beginning for us.
Yeah.
So, as a New Year interview, we'd like to conclude last year and prospect the new start. And as an associate editor of the Invasive Surgery, can you provide an overall evaluation of journal's past year's performance and offer some suggestions for improvement?
Oh, I think it's been wonderful, and everything from the journal office to the editors and the associate editors and the editorial board has been engaging and superb. I have started 4 journals in the past, okay, as editor-in-chief, so I know how much work it is to go get it all done. And what's been very impressive to me is that usually the publishers are not as engaged and they will let the editors go and do their thing. But here it's been a lot of guidance, a lot of collaboration, and a lot of follow-up. Okay, and so that's been wonderful. But that's reflected in what's happened, right? The 139 papers submitted to a new journal with no impact factor is quite an accomplishment. Okay. You're putting together the number of special issues is a lot of work. Okay, has a lot of work, and that's a testimony to how committed the editorial board is, as well as how good the editorial office is. So from all that, I've been very impressed, and so my only advice would just be keep working hard, but I think all of us do that, and I think I continue communicating and continue pushing us to go and achieve with the journal and for the journal and for the field. So thank you very much for involving us. And I think there should be a huge congratulations to you and to Professor Biliary and the entire leadership of the journal.
Thank you. Well, working hard and thank for your continuous support, especially in special issues, also this interview and also the upcoming webinars. Thank you. And in the brand new year, many experts are always chasing the start of state-of-art trends to do their researches. So as we all know, with the advancements in medical technology, how do you see the role of artificial intelligence and robotics shaping the future of surgical procedures, and what potential benefits or challenges do you foresee?
Oh, these are exciting times for surgery, and that's because we have gotten to a point where surgery has become enormously safe and highly effective. Just think about cancer. 90% of cancer is what we call solid tumor, and in solid tumor, so those are things like breast cancer and lung cancer and colon cancer and prostate cancer and liver cancer. In all of these cancers, if you cannot remove it and at some point, and if the surgeon is not expert, you will not be cured. Okay, so every patient cured of cancer in solid tumors has to be an operation. So the developments in surgery to go deal with cancer has been so good over the last 3, 4 decades, but now it's become minimally invasive. We can now do giant liver and intestinal and lung and esophageal surgeries through little incisions, and so I always tell my fellows these are great times because not only are we able now to get more cures, we're able to do it less invasively. Okay, so more cures, less invasive is how I think about where surgery is at present. But in these last few years, it's even become more exciting. Okay, and that's because all of these technologies now have come to artificial intelligence and robotics. And I think of robotics as nothing but minimal invasive surgery with a computer interface. Okay, the computer allows us to be able to control instruments in a much better way. Computers allow us to see better in terms of visualization of the tumors and the surgical fields. Computers allow us to be using other resources such as artificial intelligence to guide exactly how we go do it. So these are very exciting times. Okay, so we have now moved even further along, and not only are we doing lots of cures, less invasively. Now, we actually have the promise that these computers and computer algorithms are going to now allow us to move to the next phase, which will be automation, automatic safeguards through artificial intelligence, remote surgery, okay? And then at some point, I think that combining all of this, we're going to be able to even take better care of patients than we are now. So very exciting times, and I could say that for all the other surgical disciplines. But again, what I do is mostly cancer, and in cancer, it's been wonderful. And I'm expecting that many of the discoveries in artificial intelligence robotics will be brought forward in the next few years. And I'm certainly hoping mini invasive surgery, MIS surgery, this journal will help bring it forward, educate the folks not only within the field, but for surgeons in general, and then also folks that design robots and design artificial intelligence. And so looking forward to using this as a platform to help us move the field along. So exciting times.
Okay, thanks for insights. So how to manage these challenges can be a prospective trend in the future. We believe it can better assist surgical procedures and help patients with less invasive. And our journal will always focus on the artificial intelligence and robotics in the surgery. Okay, thank you. And so can you highlight any recent breakthroughs or developments in mini-invasive surgery or in your field that you find particularly promising or groundbreaking?
Yep. So if you think about robotics, which is something that we do a lot in my hospital and in my group, okay, and robotics really truly started probably 2003, 2004, but really for a whole decade, it was really experts doing few cases and writing about it and showing their videos, and it remained expert surgery. Then the next 10 years, it became disseminated. And it became that many surgeons now can do robotics, have access to robotics, and it's moving forward doing it and gathering data to prove that it actually is better surgery. Okay. And so that data includes data that says patients recover better and recover faster and possibly could be having better operations. And because we can see better, control tools better, and allow the patients to recover faster, it may be better in terms of an overall outcome. And therefore, again, all that data is now coming out. Okay. And so very exciting times that no longer are we arguing without data. We have data in most of the fields. And that's what many invasive surgery, the journal, and many other journals like us are able to now publish and help the field move forward. But the benefits of robotic surgery is not just for the patient, okay? It's also for the surgeon. Ergonomic challenges in surgery has always been a problem. Doing a giant big operation open, you have to bend the very odd ways, and that's why it's hard work, and many times surgeons will get injured, okay, and they get injured in neck injuries from bending the wrong way, arm injuries, and so there's no doubt that robotic surgery has made it better, okay? And so then for society, if we could really now use AI and use robotics and take the next step, telesurgery, where we can now move it forward and hopefully be able to operate from afar, might then allow us to teach without getting on a plane and traveling a long distance, allow us to treat patients that may not be able to come to us in the place where we practice, even if we are able to help them with an operation. And then with many robots entering the field, it's also that I predict the cost of robotics will come down, and I think it'll be much more accessible to patients. So I think ultimately for the society, robotics will be better. And so again, really exciting times to see robotics become better for patients and documented so, and better for surgeons, and hopefully very soon, much better for society.
Okay, thank you so much. That would be important for the academic community, including journals like us, to do researches and advance the field. And now you just mentioned the data from your team to about the AI, about robotic surgery. So how do you plan to involve the broader medical community in these efforts?
So studying minimally invasive surgery and robotics and cancer, for example, is no longer just a thing for surgeons, because we're now operating on many patients that we can actually send home very, very quickly. Okay. So recently we presented a paper from my group documenting 307 patients who had liver surgery robotically who went home on the same day. And so suddenly, here is a big operation that used to keep somebody in the hospital for a week, and used to be even require some of the patients stay in the intensive care unit, but now they were actually out of the hospital and at home. And so, what that has created is really an opportunity to go and bring other medical specialties to help us go and take care of these patients. So remote medicine, how do we go follow these patients and check up on them and make sure they're doing fine? I looking at nutrition at home and support of rehabilitation and many other things that we used to do in the hospital, but now doing it remotely. So I think what this has done, robotics for us, is really now bring many of the other disciplines in to work with us to deliver on better care for the patients. So I think these are great times for collaboration, not only for surgeons and engineers to make robotic surgery better, but for outcomes and remote medicine doctors to help us go monitor the patients at home. So again, lots of academics working together, all for the same goal, which is to make patient outcome better. Exciting times, and I'm hoping a lot of the data that is studied will be published in journals like ours and in journals like Mini Invasive Surgery, so that it becomes proven, it becomes disseminated, and it becomes used.
Okay, thanks for sharing. Collaboration sharing sites are really crucial. And as we all know, you're internationally recognized for your expertise in the cancers of liver, pancreas, gallbladder, and more. How do you manage the balance between your roles in operating rooms, laboratory research, and leadership positions? And what
Oh,
advice do you have for, what advice do you have for professionals aspiring to excel in multiple domains?
yeah. So again, I've been very, very fortunate. Yeah, people always go, "You have so many things you do in a day or in a week or in a month. Is it worth it?" And I go, "Listen, I only do things that I like." Okay, and taking care of patients, there's no greater pleasure and privilege than being able to help someone get well who is sick. Okay, and teaching young people to be next generation leaders in surgery, that's a privilege. Okay, and that's what connects us from this generation to the next generation. Inventing new things, either for the operating room or for gene therapy, which is another area I work on. Doing all of that is a privilege. Okay, is society entrusting us with resources to go study new things. So I always tell people I go to work every day and only do what I like, and but it's a lot. But the way to go accomplish it, and I've been trying to teach my young people that is to collaborate, is really to go find colleagues of like mind and colleagues who want to help people, who want to go grow the field, who want to make contributions to the field, work together and deliver on all the promises that science and surgery and medicine offer us. And so again, I've been very fortunate in that I've been surrounded by really smart people who let me listen, who let me learn, and then who work with me to go advance the fields. So that's my advice to everybody: is that again, work together with others and keep thinking of what are the most important goals to accomplish and go do it together. So it's about working with other smart people.
Okay, thanks for this. It gives a lot of enlightenment to work together and learn about the people surrounding you, and it must be a way to your success. And lastly, for young professionals aspiring to make a difference in their field, what advice would you offer, and how can they navigate the challenges and opportunities in the ever-evolving landscape of medical community?
Yeah. So for the young people, I always say, find a passion, find something you really like doing. Then find a mentor who does it, okay? And that's because if you find the right mentor, somebody who really cares about an area in science or medicine that you would like to excel in, and they take you under their wings and help you, you will go far, far along that field. Okay. So I think it's that. It's finding what you do that is of importance, and then finding people who will teach you and help you go do it. But then lastly, find some time for yourself. Okay. And it's really important because again, I always find some time in the week where I am doing it for me, my family, my wife, and it's because that's important too. Okay, yeah, there are other things than work, and but it's certainly nice to enjoy going to work, but it's also important to find all those exciting things at home that are important to go push forward to. That makes for a full life.
Thank you so much. Valuable guidance was very professional, and hope they can encourage by this interview. And that's all for the questions for this interview. And thank you sincerely for sharing valuable insights and your time. Your contributions are immensely appreciated. And
Yeah.
we're also so happy to see you again February 13th for a webinar.
Yeah.
And we're excited to share you that Professor Chen Xiaoping from Wuhan Tongji Hospital will prepare as a speaker for a webinar.
Oh,
Yeah,
wonderful. Oh,
we know you know each other, right?
yes, good friend. Okay. And so looking forward to the webinar, and thank you again for the privilege of working with this journal. Okay. And so Happy New Year.
Happy New Year. Have a good day.
Yeah.
I'll see
Bye-bye.
you next time. Bye.